Good evening all. Today our class is about patella bone. It is important for 5 marks. Before starting the class, please share the video with your friends and classmates and do subscribe to our channel. And one more thing, follow us on Instagram for notes. Insta ID is available in description. Now coming to the concept, today our class is about patella and this is the shape of the patella, and the main points that regarding the patella is we will study about the side determination, anatomical position, features of patella as well as clinical anatomy. Now coming to the point, see the patella is also called as sesamoid bone. Patella is a sesamoid bone. Sesamoid bone. Sesamoid bone means, see, the bone which is independent of its own. That means now coming to the language of Telugu, sesamoid bone means స్వతంత్రంగా దేనికి సంబంధం లేకుండా ఉండే బోన్ని సెసమాయిడ్ బోన్ అంటాము. దట్ మీన్స్ the bone which is present independently. Okay, next, this is the patella is the sesamoid bone in the body. Next, it is developed in the tendon of quadriceps femoris. Quadriceps femoris means 4 muscles that attaches to this patella. We will discuss it in the other concepts while studying about the knee joint. Next, it is situated in the front. It is situated in front of the lower end of femur. It is situated in front of lower end of femur. If it is the lower end of femur, it is situated in front of the lower end of femur, about 1 cm above knee joint. Okay, this is fibula, this is tibia. It is situated in between these femur, tibia and fibula. This is knee joint. Next, coming to the side determination of this patella. Side determination, first thing, the patella bone is triangular shape. See, the shape of the patella is triangular shape, like this. Shape of patella is triangular shape, and the apex, see, I already told where the 2 points meet is called apex, and the apex is present at a lower side, and the apex is non-articular posteriorly. See, coming to the apex side, it is non-articular in the posterior surface. Next, anterior surface, if the patella in the anterior surface is rough and non-articular. Anterior surface is rough and non-articular. Only skin is attached to this anterior surface. Next, it's upper 3/4. That means upper 3/4. Upper 3/4 of posterior surface is, see, now coming to the point of posterior surface, is smooth and articular. Smooth and articular. The posterior articular surface is divided by vertical ridge. See, if think that it is the posterior surface, the posterior surface is divided by vertical ridge. This is the vertical ridge into larger lateral and smaller medial. See, this is the larger area, so it is lateral side, larger lateral, and this is the smaller area, so it is medial side, smaller medial area. Larger lateral area and smaller medial area. Next, so now coming to some general knowledge, the bone laid on a table, if the bone is kept on the table, on the board, think that it is the bone that is kept on the board. See, the lateral articular area and determine the side of the bone. The lateral articular area rests on the board. See, this is the lateral articular area, means posterior 3/4 area. This area lie on the bone or takes rest on the board. Remaining part just in the air, just stands in the air. Okay, this is about the side determination of this patella bone. Next, coming to the anatomical position. The anatomical position of the patella bone, the anterior surface is rough and it is put anteriorly with its apex pointing downwards. See, this apex points always downwards, and the anterior surface, we can determine the anterior surface is rough. So we can determine what is anterior surface and what is posterior surface. See, posterior surface is rough, posterior surface is smooth, and the anterior surface is rough. Okay, the posterior area is put posteriorly. Next, coming to the features of this bone. Features. See, this bone contains one apex. This bone contains one apex and three borders and two surfaces. One apex is apex and two borders are superior, lateral and medial. Next, coming to the surfaces, two surfaces are anterior and posterior surface. Now coming to the apex of the bone, coming to the features, apex of the bone, it is directed downwards, it is rough and vertically rigid. See, it is vertically rigid. Next, it is covered by tendon of rectus femoris. Covered by tendon of rectus femoris. Next, it is separated from skin by patellar, pre-patellar bursa. Bursa means a space. It is separated from skin by pre-patellar bursa. This is all about the apex. Now coming to the surfaces. Here the only posterior surface is mentioned clearly. Remaining all surfaces are not mentioned in the textbooks. Now we will study about the posterior surface. There are three surfaces. There are two surfaces. In that we are going to study the posterior surface. Posterior surface. The posterior surface is articular. See, if you think that it is the posterior surface, the posterior surface is articular in its 3/4 that we have studied already. 3/4 is of posterior surface is articular and the last 1/4 is non-articular at the apex side. That means at the lower side. Okay, non-articular area. This is non-articular area. Next, articular area is divided by vertical ridge into lateral and medial portion. Now we will discuss clearly about the articular surface. Only about the articular surface we are studying about the articular surface. See, the articular surface is divided by vertical ridge into lateral and medial portion. This is lateral portion. This is medial portion. Okay, next, another vertical ridge separates a medial strip from medial portion. This is medial portion. Another vertical ridge separates medial strip from medial portion. That means we will draw again vertically in the medial region. Next, this strip articulates with the reciprocal strip on the medial side of intercondylar notch of femur. See, if it is the femur bone, this strip articulates with the reciprocal strip. Reciprocal means crisscross, like this. Okay, like this. If for example, now coming to the mathematical example, it will be easy to understand. If it is the main one 3/2 and its reciprocal is 2/3, understood? Crisscross method, and this strip articulates reciprocally with the strip of femur. That means at the intercondylar notch of femur during full flexion. Okay, this strip attaches with the intercondylar fossa of femur during full flexion. During full flexion, this area during full flexion. Next, this rest of the median portion. That means here rest of the median portion and lateral portion. These two portions of articular surface are divided by two transverse lines into three pairs. That means we have to draw two transverse lines like this. So it is divided into three parts: 1, 2 and 3. 1, 2 and 3. Okay. Next, we will name these boxes. I mean these parts. This one is 1, 1, 2, 2, 3, 3, and this is medial strip area is 4. Okay. Next, during the various phases of movements, this knee joint articulates the patella in different forms with the femur bone. Okay, these lower pair articulates during, see, these one pair 1 articulates with femur. Okay, during extension. Next, these two, that means this middle area articulates with femur during beginning of flexion. This upper pair articulates with, that means 3. This is 2, this is 3, articulates with femur during mid flexion. This is during extension, lower at middle point is during beginning of flexion, and upper part is during mid flexion. Now coming to this fourth one, the medial strip attaches with femur during full flexion of knee. Full flexion of knee. I hope you understood. This is the articular surface of this posterior surface of patella, and this is the movements when the patella region attaches with the femur. Okay, ఈ మూమెంట్స్ జరిగినప్పుడు, దట్ మీన్స్ ఎక్స్టెన్షన్, బిగినింగ్ ఆఫ్ ఫ్లెక్షన్ అండ్ మిడ్ ఫ్లెక్షన్, ఈ పటెల్లా బోన్ ఏమేం పార్ట్స్లో ఫేమర్కి అటాచ్ అవుతుందో ఇట్ ఈస్ given clearly in here. It is explained clearly here. I hope you all understood. Now coming to the clinical aspects of this patella bone. So the first clinical aspect for any synovial joint is, that means this patella bone is also belongs to the synovial joint of knee joint. So any synovial joint, any bone that belongs to synovial joint is, first thing, dislocation. This is common for every bone that that belongs to this synovial fluid. Okay, dislocation of patella bone, patella, because of angulation between long axis of thigh and leg. If the angle of this long axis of thigh and leg is more, there will be dislocation of this patella bone. Next, coming to the fracture of, next point is fracture of patella bone. Fracture of patella bone. Okay, next, during sudden severe contraction of quadriceps, that means 4 muscles, quadriceps muscles, if there is sudden contraction of these 4 quadriceps muscles, the tibial tuberosity may get avulsed. Tibial tuberosity, while studying about tibia we will know about the tibial tuberosity. I will tell again while studying about the tibia. This tibial tuberosity get avulsed, that means tear. Avulsed means tear or pulled. Avulsed means tear or pulled. Okay, that tibial tuberosity get avulsed. Next, bursitis occurs in prepatellar and subcutaneous infrapatellar bursa. Okay, bursitis occurs in prepatellar and subcutaneous infrapatellar bursa. This is all about the clinical aspects of this patella. There are 4 clinical aspects: dislocation, fracture, bursitis, and tibial tuberosity gets avulsed. This is all for today's class, and we will meet again tomorrow. Thank you all.